do during this time. Hey, I was just filling.
Hey, how are you?
Nazarian is here.
How's it going?
Everything is going well. Thank you so much. I was really looking forward to talking today. Thank you so much for giving us your time and your expertise. We're very honored to have you here today. And for a lot of people who just joined, I would love for both of us actually, but of course I'd like to start with you giving a little bit of background about what's going on with you and what it is that you do. We're really excited and proud about the Netflix series, and I want you to give a shout out to that and let everyone know. Go ahead, Sheila.
Thanks. So I'm a board certified plastic surgeon in Beverly Hills. I've been out in practice now for about 7-8 years. I have 3 kids, married to a neurosurgeon, and you know, finally got our Netflix show after many years of dreaming and trying. Finally happened, and we're just really proud of it. And it's received amazing feedback, especially on the plastic surgical stuff. And yeah, it's just been a dream come true on the best network ever.
Yes, of course. Well, we're very proud of you. Very, very proud of you. That's amazing. Your reputation is unbelievable in town, and everyone loves you, and very talented physician.
I don't know about that, Shahin. I got some haters out there.
We all do. You know what? You haven't made it in life if every single person, the 4 people you know, like you. So
yeah, that's true.
It's okay.
True that. True that.
Yes.
I don't know. I just think it's been good though. The show I think has brought a lot of people around because I think you know, it's the first time I think plastic surgery's kind of been shown in an elevated, respectful kind of way. So I feel like that's good for the industry kind of as a whole. So it's kind of, you know, brought people around, and instead of being like, who does she think she is on Instagram, I think they're like, damn, she made it. Okay, good.
Someone just asked what the name of the show is. Do you want to make sure you let everyone know?
Yeah, I'm using the lip gloss you sent me.
Enjoy it.
It's so good. Yeah, so the show's called Skin Decision, Before and After, and it really just highlights kind of what it is that aesthetic procedures do for people on the inside. It's not a circus. It doesn't make a spectacle of the doctor or the patient. It's really just a very respectful look into why people get aesthetic surgery and what the results of that can be on a psychological and emotional level.
And I love hearing that, because in medicine, it's so sad that they make these TV shows that really make a mockery of a lot of the things that we've worked so incredibly hard. I remember we were filming a pilot for a TV show, and this is right before Octomom hit, and then like no one wanted to hear the word.
Oh yeah.
It took a while to get rid of it, but they came to my house and they were filming, and they're like, now I want all of you and your friends and we had a little dinner party. They wanted us to do shots, and I'm like, this is not what. And they're like, I want you to drive really fast out of your driveway, and I'm like, no, this is
it's funny because I was under contract actually for a year with another network. I'm spilling all the tea now. But yeah, they were like, say this, and I'm like, I'm not saying that, and they're like, well, then you're not gonna get a show. I was like, I don't care.
Yeah, I know.
Then I don't get a show, like.
And we've all been there where, you know, I did little shows here and there. I did this one show, Little Women of LA, and they came in and they cut and pasted every single thing I said to make me seem like a complete jerk. And then the next week they went to another doctor and they made him seem like the humble, nice guy.
No way.
I was like, this is not happening anymore. This is
the nice thing about Netflix is they actually are the opposite. Like if I say something that like makes me look dumb, they'll cut that out.
They're smart. Hey, send them over.
I know, it's so much better, honestly. Like I just think they have a different, you know, reputation, different focus, like all of that stuff.
Well, Netflix is amazing. They've done amazing. They have great shows. They put a nice spin on everything. With all of that being said, there's so many questions that come up in my practice all the time about what can and cannot be done. And honestly, like I basically say, don't do anything because I don't know all the answers. And for those of you watching, I'm Dr. Shahin Ghadir. I'm a fertility specialist also here in Beverly Hills. And I'm not exactly sure where your office is, Sheila.
I'm actually on Spalding. I took over Dr. Nassif's old space.
I know. So it's about a 1-minute walk from my office. I'm on
exactly.
So we're very, very, very close by to each other. So that's nice. I didn't know that. That's wonderful news. And we have one of the largest fertility practices on the West Coast. We have the largest IVF lab, and all the docs at Cedars and at UCLA and about like 29 doctors in the community use the IVF lab. So we're very proud of a lab that's done really well for us. But we get a lot of patients that come in from the community, and you can see like this, you know, Southern California, people are really caring about how beautiful they look and what they look like all the time. And trying to do fertility, like the number one question I get before anything, before the success rate, people are asking, well, am I going to gain weight? And am I going to be able to do my Botox? And what is it going to do to my skin? So we're, of course, cognizant. And I'd love to take this opportunity with your expertise to kind of answer questions about, you know, Botox, about filler, about things that are safe and are not for pregnancy. And then do you agree with deducing and taking that information and bringing it into the process the same as while you're making your egg? You know, these are the kind of things that I think we should kind of get our goal today in answering.
Yeah,
and
totally.
Also, as a mom of 3, if you have any advice for someone who's going to be a professional, and how challenging it is and the things to do to allow women to empower themselves during this process of building their careers.
Yeah, no, I mean, I actually, you know, we're both Persian in the community, and family is super, you know, important. And it's kind of like family and education. Those are like the 2 things that are, I think, the most important growing up and in our culture. So for me, it would have, I wouldn't have felt as fulfilled if I didn't have a family and just focused on my career. So it was really important to me. And also the thing, this is great talking to you. I remember being a medical student, and I had literally put it, I was a 4th-year medical student at Albert Einstein in the Bronx, and I put it out to all my family members, I'm ready to get married, like hook it up, you know, because I literally wrote it on my to-do list. I wrote get married. Because, you know, at Albert Einstein, sorry, I'm trying to make this brighter, at Albert Einstein, like, you know, they're all Orthodox Jews, so they already have like 3 or 4 kids by the time they're in medical school. And so when I was walking to like my classes, there would be like 20 kids chalk drawing on the floor between the doors and the classes. So I was like, holy crap, I'm behind, you know? But I remember doing a rotation at USC, and I was sitting with one of the chief residents in general surgery. And you know, by the time you graduate residency, you're like 33, 34 years old. And she was like, I was like, yeah, no, I need to get, you know, married. And she's like, I wish somebody would have told me that earlier, because our eggs do dry up, you know, as you know, you've built a career on it, you know, it happens. And unfortunately, you know, women being very career minded these days, which is great, they kind of forget that like your personal life maybe needs to like, you need to put as much effort in that as you do in your career. So I tell all my medical students and residents, I'm like, they'll be like, yeah, I published this paper and I did this. And I'm like, okay, put on some red lipstick, go out, meet a guy. If that's important to them, which a lot of them, it is important. I just feel like you have to, nobody else is telling them that, you know, your attendings aren't going to say, you know, don't work as hard, go date someone. Like, you know what I mean? They're not going to tell you that. So I feel like I'm the one that's like.
The balance of life as a physician is very challenging. And I'm going to be very honest. I think it's by far more challenging for a female physician than for a male physician. Because I'm 100%. Sitting here and my wife's at home helping my 4 kids, getting on Zooms, getting off of Zooms. She's like a IT person. She's a hall monitor. She's the lunch mom. She's the PE teacher. I mean, these are things that no one in this generation ever signed up for. But I think the best advice that you're giving, you know, young women that are coming and doing rotations with you is that think about your entire life. If it was up to me, the first thing that I would say is that the first week of, or the first 10 days of residency is when you're going to be freezing your eggs, and then you can go do everything you want to do. So freezing your eggs is so important, especially by the beginning of your residency, because that just gets harder and harder and harder as we get into residency more and more. And it's really hard to have an opportunity like that. We get a lot of women that are coming to us once they've finished residency. And that, unfortunately, is not the best time to do it. We tell everyone, the younger you are, the better it is to freeze your eggs. I can count probably on my hands and toes the number of women that have come to me in their 20s. I mean, it's definitely under 20. Yeah. And it's always because of a reason, like someone lost an ovary because of a cyst or something bad happened, and now they only have one and it brought it to their attention. But otherwise, we're getting more and more people educated to come in and talk to us when they're 30. But again, I had someone today, you know, 42 years old, and it's still better than nothing. We still do our absolute best. And luckily, our technology is good that some women, 43, 44, have still been able to use their eggs and do really well in terms of success in live birth, but it's not for everyone. So people have to be very smart about it. So thank you for promoting that. I really appreciate that.
So yeah, I just went on a mission, dated like 1 million people. Half of them told me, I can't keep dating you if you want to be a surgeon.
Really? Well,
I had a tough time showing these Persian men.
You know what? Those Persian men were obviously not the right men for you.
No, thank God. You know what's so funny? I always say, you know, when you meet the right guy, you're like, thank God those other guys didn't work out. But yeah, no, finally when I met my husband, he's a neurosurgeon. So to him, plastic surgery is, you know, not that big of a deal. So he was great. We were actually engaged in 3 months.
Wow.
And we got married my 2nd month of internship. And I had 2 babies in general surgery, 1 baby in plastic surgery. So I knocked them all out in residency. It was very difficult.
That's amazing.
I remember it's all a blur. I was so exhausted, but we knocked them out during residency just because I knew it was going to be, you know, fertility afterwards because I graduated, I was 33, you know, it's.
Wow.
So yeah, so I kind of made it all.
By the way,
you're getting
compliment after compliment. I'm trying to, this is the most, people don't understand why you're doing the live. It is so difficult to keep the conversation, but like trying to be reading the comments. And sometimes, like I was just doing an Instagram live and someone's like, he's so arrogant. I didn't even know where to go with it. I was talking about how to make babies. So it's so hard to get distracted, but I have gotten distracted in a very, very nice manner. People are giving you compliment after compliment after compliment. So that's a really lovely thing to get. So and obviously the show is going well because so many people are saying that it's going absolutely perfect. Yeah,
no, I mean, thank God the show, I think, and also like Instagram in general, you know, it's really funny because before the show, it's crazy. I would get maybe like 1,000, 2,000 likes per photo. But like so many impressions, like if you go into the insights, just the engagement, like nobody would actually like anything. Now it's like people are so supportive. I think it's really brought to light, you know, who I am. And it's not just competitors watching me and like seeing, you know, following me to see what I'm doing, but never commenting, never liking. Now it's like the world can see who I am. And I'm a, you know, open book. What you see is what you get.
That is so nice. That is so nice to hear. And I think you know how to use Instagram a lot better than I do because I don't know which competitor watches me. I don't know who checks. I just looked at the likes. I don't even know who's been liking it. But this whole aspect of social media in my world is very different because a lot of people don't want someone to see that they're following a fertility specialist.
Same with plastic surgery. Nobody comments because they think then all their friends could, wow. You're going to go get plastic surgery. Oh my God. Wow. But I've actually had people say that. I've had patients say that.
Pre and post pictures without showing someone's face and not knowing who it is. You know, in my world, they just can't make up a story with like a name like Mary's so happy she had twins. You know, like just it doesn't make sense. But it's okay. I've used this platform to educate people. And
exactly.
In the last 6-7 months that I've really worked on this platform, it has helped so much, and I've gotten such tremendous feedback from people. And it's been very worthwhile. So I'm ecstatic about where my page has gone. I think for what I do, I've done really well with it, so it's okay.
Yeah. Don't think for what I do, honestly, like there's so, like, there's internal medicine doctors with 2 million followers. You know, I don't think it's that. I think what we have to remember is that, you know, us as physicians, what might seem super simple and like, you know, oh, everybody knows that. Well, not everybody knows that. And you have more knowledge about what you do in your pinky finger than the general public does. So even my husband who does brain and spine surgery, I'm like, talk about spine health, talk about ergonomics, posture, like all of the things that people could do that actually can make a difference in spine health. You know, and he's like, oh, you know, I think we forget that
I have to say, I think that women are a lot better than this. Because they're probably on more and they see what other people, because my wife is giving me like, why do you talk about that? I'm like, oh my God, why didn't I think about that? I never even thought about doing something like that. So that is really good. And hopefully one day when my Netflix TV show goes, I'll be getting more likes as well. Actually, I got a really funny message from a woman in Iran yesterday saying that she was a voice message and she was sending a message from Esfahan and she said, you have so few followers and so few likes. can you please tell me how you got verified with a blue check? And I just...
What'd you say?
I had to look at her profile. I looked, and she's an aerobics teacher in Esfahan, which I loved. Okay.
That's so cute.
I didn't respond because what am I going to say? I mean, I think there's a different level of importance to some positions and others. And some people at Instagram thought that it's very important to make sure that the right information is going. And once I had multiple people making fake pages, which I still can't understand, you know, that was the big game changer for us. So I thought it was hilarious that someone said that. I'm like, and I listened to it twice. I couldn't. I'm like, she didn't just say I get very few likes. I mean, I'm getting like 300-400 likes, 500 likes on a picture. That's a lot for me, and I'm really happy.
Yeah.
Okay, so let's answer the big questions.
Okay, let's do it.
Doing a stimulation cycle to get eggs out, whether they're to be frozen or whether they are to be made into embryos to get pregnant.
Right.
What are your thoughts about Botox first?
You know, it kind of, you know, I just think like the bigger question that we have to answer and like the big elephant in the room that we have to address before we even get into this is how sue-happy and litigious Americans are, and how a lot of medicine is performed, you know, we call it defensive medicine. Like there's so many tests ordered, there's so many things that are said and done just so, you know, we don't get sued. Like, you know, look at massages in the first trimester. Do we actually think a massage is going to like abort a fetus? You know, what are your thoughts on that? But I know like when I got pregnant, like that is the time I needed a massage and nobody would freaking massage me.
You can get a massage, but the problem is that there's a lot of people that don't know. So they're afraid they're going to kill your child if they massage you. There are certain spots on the body, like behind,
like the ankles,
that is potentially, and I don't know what kind of research was done. They're like, let's put half the women in massages with and half the women without, and see what happens. I don't know what the data is.
That research has never been done.
Never been done. But who's going to risk it? You know,
that's what I'm saying. So literally, like all of the stuff that we do, like I will tell you, I have OBGYNs as patients, many. And like midwives as patients, many. And they will actually sign off on their own Botox, you know, when they're breastfeeding, or they will they'll pump and dump, you know, like they will do it for themselves and they're actual professionals. And when they sign off, you know, I'm like, okay, you know, and when I was I using retinol when I was breastfeeding? I was, because it's like low dose and it's not going anywhere. You know what I mean? But would I say to a patient, go ahead and do that? No, of course not. I'm going to stay on the safe side. I don't want to be blamed for anything. Like, what percentages of fetuses abort in the first trimester anyway?
15%.
So it can happen anywho. Right. But if I stick a needle in you, you're going to blame it on me. So therefore, I'm not going to do it, because who's going to risk that?
Right.
So I think like we have to just say, you know, it is so, you know, litigious, sue happy. People are looking for people to blame for things that could have happened anyway. So that's how we practice medicine. And a lot of these studies don't get done ever. Because who's going to say, all right, you bunch of pregnant ladies, let's do Botox in you and see what happens. Like that study's never going to get done. So we'll never really have an answer. But we can talk about like what we know is safe and what we really don't know if it's safe or not. So we don't do it.
Right. And that's why, sadly, my answer to everything is do it before you start the egg creation process. And just make sure that we're just all good. We're just going a week earlier. We're good. We're happy. We'll let you
literally, I have patients that are like, I'm going to start IVF in 2 weeks. And they like run in for all their fillers and Botox and lasers and everything. And then they start.
You know, do you think that there's a difference between fillers and Botox when it comes to this? Or is that basically your answer the same?
I mean, logically, again, yes, I do. I mean, Botox is, you know, a toxin from honey, you know, botulism. Do I think it's going to travel all over the body and affect your fetus? Probably not. But that is like a toxin. So I'd probably say that would be higher in the no category for me than a hyaluronic acid filler, which is not moving anywhere. Hyaluronic acid is something that's naturally occurring in our bodies anyhow. So to me, that would be in the safer category than not. Now the question comes up, hyaluronic acid, let's say, does get into a vessel. Let's say it does get into a vein, and then we have to do other treatments, which is really rare, by the way, or else half of Beverly Hills would have like facial necrosis and be blind. But, you know, like then the procedures, or let's say it gets infected and then we can't give a certain antibiotic. So that's sort of, you know, kind of gets into a thing, even though things are rare. So in general, I say no.
So that's interesting that you said that. So when you're giving these fillers, do they go that deep that it goes into blood vessels, or is it that the superficial...
I mean, it can. Typically, deeper is safer. So, like right on bone, right on periosteum, there are no, vessels typically. So, injecting right on bone, like jaw, chin, tear trough, temple, straight in, cheek, typically that's safe. How do
you control where, like, let's say, I'm getting fascinated. So let's say, like, I wanted to build my chin out, and they do these things with fillers now. You just go to the bone and just inject it and just pray that it just goes in the right direction?
It's not pray. I mean, we control where, it goes.
Okay.
It's not a liquid that will just, like, spread like Botox is. It's an actual, like, gel. So it doesn't just, like, go wherever it wants to. It's actually pretty accurate.
Got it. Okay. See, I love it how as one physician in one field, you know nothing about another field.
I know. I mean, that's why it's so important to specialize. You have to be like a master of one thing,
Yeah, absolutely. So that's really, really interesting. Now, what about lasers?
So lasers are certain lasers that don't require any numbing, that just is like a laser. They're typically lighter lasers. Those typically we say are safe. Now, we have to keep in mind that the hormonal changes can make people more prone to melasma or more prone to pain, for example, more prone to acne sometimes. So we will use lasers that are actually safe for melasma or safe for, those things that can happen. Actually, we use to treat melasma. So there are certain lasers, and I own like 25 lasers. I literally have I have vaginal tightening lasers. I mean, I have like literally every kind of laser.
We have those as well.
Yes. So I always say people like, if we have everything. So we will just basically pick the laser that will be safe, not just for pregnancy because it doesn't require numbing, but also we use to treat some of the sequelae of the hormonal changes of pregnancy.
That's so interesting. So those are most of the questions that I get beforehand. Is there anything else that I'm missing that people ask beforehand?
Skincare products, I would say. So we usually typically recommend, non-chemical sunscreens during pregnancy. So all physical sunscreens, because they're basically sitting on the skin. They don't penetrate the skin. And some of the ingredients in chemical sunscreens in higher doses obviously have been linked to issues with fetal development. So we typically say use an all physical sunscreen. So you want to see either titanium or zinc be the two ingredients. Then it's a physical sunscreen. When it starts getting into more...
Those are the sunscreens that are going to be sitting on your skin making you look white.
Right. So basically those sunscreens actually, it's kind of like wearing a mask. Like they'll actually block...
Right.
The UV rays from penetrating. The chemical sunscreens, what they do is they actually turn the sun's rays into heat, it then evaporates off. But that heat can also cause melasma. You know what I mean? In patients that are prone to melasma, it can worsen melasma.
I totally see it, yeah.
Yeah, so typically when sometimes patients will come in with melasma and they're like, I wear sunscreen every day, but they're wearing a chemical sunscreen and heat triggers melasma. So they're actually wearing sunscreen, but their sunscreen hurting them.
That is so interesting.
Yeah.
I love that.
So we usually do a physical.
So I noticed the other day I was putting a sunscreen on because I've been spending a lot of time on the weekends now in the sun.
Good.
Mineral sunscreen.
Yeah, so those are typically physical sunscreens.
Okay. So those
so like Color Science makes a bunch of them that are really great. Elta MD also. Usually the brands will have a chemical sunscreen, a blend of both, or just a physical. The reason why people use chemical at all is because it tends to be more sheer and tends to look more dewy and almost makeup-like. But now, honestly, the technology for physical sunscreens have gotten so fantastic that, you can almost mimic a chemical result with an all physical.
Because the mineral one honestly spreads so easily.
Right.
And smoothly, and it's the quickest way I can get it on my kids without them running away. Because my wife will just like, they didn't wear
Just check the back though and make sure, it says zinc and titanium and not all of the oxalates,
Okay.
And those the sunscreens that are physical also, tend to advertise that they're reef safe and ocean safe and all of that stuff.
Yes,
so
of course. We want the reefs not to be hurt in any way, of course.
Yes.
Not that we're traveling to reefs that much these days, which is a different
Yeah.
topic. But okay, that's great. And someone just asked about hair removal.
Yeah, laser hair removal. So again, this should be totally safe during pregnancy as well. We typically say, check with your OBGYN, see what they say. But I mean, again, it's laser hair removal attacks black pigment in the hair or dark pigment in the hair. So for example, typical laser hair removal, you can't do it on blonde people, people with white hair or red hair. It really attacks that dark chromophore. So it doesn't penetrate or go anywhere else. So yes, it should be safe for pregnancy. Wow. Okay. But we always say, double check with your OB, see what they say, but if you're not, and newer technologies too are less painful. Like we have an awesome laser that actually has all 3 wavelengths in one tip, and it's a rolling mechanism. And I know all the Persian, I'm sure your wife had laser hair removal like all Persians have. It used to be a snapping, and it's very painful and sometimes requires numbing, where the newer technologies are just a rolling and it just feels warm. Really? So they don't hurt. Mm-hmm.
Wow, that is unbelievable. Well, yeah.
Public service announcement to all my fellow Middle Easterners up there.
Yes, listen, I've been there. I used to have it used to be just one piece. And
yeah.
I did this when I was a fellow more than 20 years ago at UCLA.
Yeah.
It was the most painful experience of my life, by the way. They were putting ice on it, and it was
still killing.
My body was shaking in pain.
I know. Now it's not like that at all, so thank God. A lot of older technologies are better. Say that again.
Is the show extra? Is there something about Brazil that's going on?
My Brazilians are amazing. Yes, we have a huge fan base in Brazil, and Philippines is pretty large too.
Wow.
Yeah, but Brazilians
so
are
many
awesome.
Brazil shout outs, so I loved it. I was like, is there something extra going on in Brazil that I'm
Well, Netflix is in 190 countries and in 30 languages. So literally only 192 countries exist. So it's very global.
Well, yeah, I've never been on Netflix as much as I have during the last 7 months, by the way. So I can tell you for sure, Netflix, yes, it is, and it's everywhere. So it's saved many people's marriages as well.
I know, it's so great. I love it. I love Netflix. I was actually when we were pitching to Netflix, I stayed on the lot for an extra 15 minutes and just prayed and manifested because that's where I wanted to be.
The most amazing thing about Netflix is that their fertility coverage that they have is unbelievable.
Yeah.
They have $75,000 per employee of fertility coverage. So we have a lot of Netflix employees coming in to freeze their eggs, freeze their embryos for the future. It allows people to also, use it towards surrogacy. It allows our gay patients to be able to use it towards their egg donors as well. Yeah. So it's huge. I mean, that's so.
No, it's an amazing company. I take care of a lot of the Netflix employees as well. And it's fantastic. It's just such a great company. It really empowers people to use their talents and sort of be creative and, do what they do best. Actually, I take a lot, if you follow the We Are Netflix Instagram, it's actually very inspiring how they lead.
Oh, wow. I didn't know that.
Yeah.
We're definitely going to look at that.
Yeah.
Okay.
So let me tell you, Shahin, other stuff too that I want to go over.
Please.
A lot of people also say retinol, don't use it during pregnancy, the vitamin A's. I think in super low doses, which is typically what people are using, it's probably fine. But again, ask your OBGYN. Definitely the oral, Accutane obviously is teratogenic. You don't want to be using that. But some alternatives that you can do for the anti-aging benefits of retinol is use vitamin C products or just other antioxidants like rosehip oil is really great. So that, that sort of vitamin C, rosehip, other botanical antioxidants are fantastic. The other thing that people say don't use is salicylic acid. I know a lot of people break out when they're going through, hormone treatments. So salicylic acid is typically a great in face wash and stuff, but they say don't use it during pregnancy or breastfeeding. So other alternatives are glycolics or lactic acid is another great one. I just took some more notes. Benzoyl peroxide also they say don't use. So again, you're having acne, you want to use benzoyl peroxide, and they say
benzoyl peroxide is not supposed to be taken.
Yeah, they say no. Yep. So basically, what we typically recommend is a sulfur mask instead. So that's another one.
So that's a mask, because
it's like a mask. Yeah, it's almost it looks like a black mask.
Oh, it's a black mask.
Or
Okay,
the black masks that can be
used. I had the
used.
desire to do that, but I didn't even know what it was or what you do. But
yeah,
so it's a sulfur mask, and then this is the one that peels off.
No, you don't have to peel it off. Sometimes they just wash off.
Ah, okay.
Yeah.
I'm not gonna lie. Whatever.
Don't use that one, Shahin. It'll rip out all your hair.
Hey, I know there's a lot of extra hair here, by the way.
I know. No, but you're doing good. And then the last ones that I just want to make mention of are hydroquinone. Obviously, that's for lightning. Don't use that. That one's, definitely a no-no. And then also some essential oils they actually say are not good either, like rosemary oil and tea tree oil. They say are no-nos as well. Yeah, and tea tree is used a lot, like people that want to get rid of acne as well. They'll get tea tree oil. So those two, those two they say don't use either. So that's kind of like the list of stuff to, in general, stay away from when it comes to skincare products.
Is that something that you put on your Instagram, or is that something that's like a list of how you?
Yeah, so actually I have the Skinspotcom, which is it's almost like the violet gray of medical grade skincare. So we actually curate medical grade skincare that's studied and proven, like actual studies, not like your favorite influencer told you it was good. So it's actually proven effective stuff. And from each brand, we don't bring on every SKU. We only bring on their hero products that are like their #1 best sellers. So that when you go look at, for example, sunscreens, you're not choosing from 200 sunscreens. You're like, what the hell? Which one's good for me? You're choosing from like the best of the best in medical grade. And usually the sunscreens are doing double duty, like there's antioxidants in them, they're anti-aging sunscreens, they have tint, so it's going to make you look better. So we try to curate the medical grade. And we do have
just repeat where people can find that?
Yeah, it's called theskinspot.com. And we have a blog called The Edit, which is up there, and this is where we have posts like this, where it says like, is retinol safe? Or what are the best products to use during pregnancy, or rosacea. So that's where we like do blog posts and actually have links to the products that are good to use. We're working on a new blog post for maskne, the acne that you get under the masks, and which products you can use to sort of DIY it at home.
Wow, that's amazing. Well, that's
we're very active.
I didn't think I'm going to learn so much. I'm just shocked about how much I didn't know and that's out there that's so important. So that's amazing. That's absolutely amazing.
Good, I'm so glad.
That is really smart. And now I'm like wondering like why my face looks so dark on the screen. I don't.
You're actually normal colored. I feel like I'm dark.
No. I'm looking so dark on this that I'm not sure if I'm like doing something wrong or like I just need
to on my end you don't. On my end I'm the one that looks darker than you. Yeah.
It looks like a black ring here, but it is what it is. We're way past that. Now I'm gonna have to come in and like put one of those things on and peel it off my face and take all the hair on the collar with it. Sheila, this has been so fun. I'm gonna just make sure that every single woman that's laying there doing something about her skin is going to be aware of her eggs as well. And we're going to remind them. Thank you for being a partner in this world to empower women. There's women like you that teach other women to do amazing things with themselves, with their lives. And congratulations to you for learning how to balance so well.
Thank you.
And honestly, everyone is so incredibly proud of you.
Thank you. You're going to make me cry. Stop.
Well, you know what? Everyone needs to be proud of themselves. And there's a time and place that everyone should be made very proud of them. I know that your family's beyond proud of you. Your extended family is as well, so that I've known forever. So thank you very much. For anyone who wants, I already saw it scrolled up there about the site, and everyone who's probably watching knows exactly where to go. If anyone needs any more information about fertility, they can come to Southern California reproductivecenter.com or my Instagram page, and we're happy to answer questions. We do a lot of webinars. Do you do webinars at all?
I do webinars mostly in like combination with the companies that I really, really like. I won't do them with companies that I don't like. So
that's so nice.
I try to keep it, honest, and people know if I speak well about something, it's because I truly believe in it. You got to keep that, reputation and stuff. Absolutely. I call them like, you know, device whores or product whores when they just like talk for anyone for money. And I don't think that's honest. When, you know, we have an MD after our name, there's a certain level of responsibility that comes. I was talking to one of my influencer friends and she's like, yeah, if I like just say I like a hair iron and it's not the best hair iron, like no one dies, you know, but for us, it's important that we,
you know, listen, like you said it, with having MD after your name, there's a certain level of integrity and honesty that are incredibly important for everyone that we have to keep up, and it's part of being a good physician, and I believe the exact same thing as well. So exactly. We do webinars though. We do webinars and they're all educational, and we're able to do so all the time. So we're able to do that. And one of these days, maybe we'll put together a webinar that would bring both of our practices together with some
let's do it.
That would do it. But thank you again for doing this with me. It was so educational. And I want to thank everyone for watching. And I'll make sure to put this back up as a post as well, and then give access to Sheila as well. But thank you, everybody. Have a wonderful evening.
Bye, everyone. Have a great night.
Okay, bye-bye.